Hey everyone, how's it going? This is going to be so cool. I actually chatted to Veerle on our podcast. Oh, there's a bit of an echo, Veerle.
Yes, I can hear you.
I can just hear a little bit of an echo. Maybe when we get some viewers online, if they can just tell us. It sounds better now. It sounds better. Yeah. Okay, great, guys. We're waiting for you guys to come online. But when I start seeing viewers, then we'll start answering some of the questions. But I want to just chat to you about Veerle. So Veerle did a podcast for me for my rehab vets, and he gave us so much information about herbs. I thought that it would be really beneficial to get it onto our Facebook Live to basically to answer your pet owner questions that you have about herbs and how you can use them with your pets. It's getting a really bad echo. Have you got only one? There's definitely only one of your things open, hey Veerle? So only one is open. You don't have two. And Facebook
Live open, huh?
Is Facebook open or just the Be Live?
Facebook and Be Live.
Okay, close Facebook.
Yeah, done. Better?
Yeah, much better. Much better. All right, cool. So, guys, if you have any questions, you can just put them in the comment section below. So just write out your question and Veerle will answer them. Veerle, I think before we sort of go into all the questions, I think that it's important that we discuss the safety of using herbs because, herbs are quite strong and they can react with other medications maybe that our pets are on. So can you just tell the listeners a little bit about herbs and safety and sort of how you would recommend that they use them and how important it is that they know sort of the interactions and the possible dangers of using some herbs?
So especially in rehab, what you get, your pets are often on a combination of different medications. So you might have supplements, medication, painkillers like gabapentin, tramadol, and it's very important that actually you put it all down on a list and actually look at the interactions. For example, say some of the anti-inflammatory herbs, for example, devil's claw would be one, can irritate the stomach, and then your non-steroidals can do that as well. So I would then say, well, I'm not going to use devil's claw. I'll use an anti-inflammatory herb, for example, that has less effect on the stomach lining. So turmeric, in some rare cases, can irritate the stomach as well, can have an interaction with blood clotting. So I saw this week a patient, and it was super tight, and I thought, I'm needing to get lots of muscle I've got a restart required on my computer, but we'll just keep going. I'll see if that works. It keeps working. So
before you carry on, Veerle, I see there are people online. Guys, can you just put in the comment section if you can hear us okay? So if whoever's online, please just say yes, we can hear you, just so that we know that you guys have got audio that side. Sorry, carry on, Veerle. I'll wait to see if we get any comments.
So I had a dog that came in and it was super tight, and I wanted to give it some herbs as muscle relaxants. And for example, I was thinking of using Angelica sinensis, viburnum, and really improve the muscle the circulation through the muscles. However, this dog was booked in for a dental, say a week later, and I said, actually, let's not, because when this dog is going to go through an anesthetic and they're going to be descaling and polishing, pulling out teeth, I don't want to really improve the circulation and have lots of bleeding going on, because a lot of the herbs that actually improve circulation will have an effect on the blood on the clotting. And so you have to be really careful with that. For example, if your dog is going to go through an anesthetic, you need to, or having some minor surgery, you need to make sure that none of the herbs you're giving are interacting with the coagulation, which could make life really difficult for the vet who's doing the surgery. So that would be one. And sort of what I see more and more is people come and they have, I'm giving this supplement and I'm giving that supplement, but they haven't got actually a strategy behind it. Because herbs do interact, you have to actually make a list and saying, well, what am I not doing? So my non-steroidals are covering this and that, but what am I not doing? Am I giving enough tummy support, if I'm giving enough liver support to actually make it more of a holistic approach. And I think that's what happens with herbs. People just throw more and more herbs at it that have an anti-inflammatory or have an analgesic effect, not thinking outside the box and thinking, well, actually, what if I make this dog have less muscle cramping, less trigger points? What am I doing to support the liver? What am I doing to support the skin and the tummy, for example? I've had a few cases this year where they were on meloxicam and they were like having gastric irritation. So nobody actually leaves my consult room now when they're on non-steroidal without me saying, right, if this tummy is going to say bang, well, it's not going to be on my watch. So what are we going to do to actually prevent this dog not tolerating the non-steroidals anymore? So it's literally this polypharmacy is really being careful what you're giving and not going over the top with, for example, valerian is good for a muscle relaxant, but if your dog is going to go through an anesthetic the next day, you better tell the people who are going to do the anesthetic that this dog has valerian in its system. So it's just stuff like that you have to be super careful with, because it's not because it's a herb that it won't do anything with all the other stuff that you're giving. And then it's also the sourcing, making sure. So some of the Chinese herbal preparations that are imported, I think it was in the UK, they found some of them were containing steroids. So stuff like that's important for the safety as well. So making sure that if you have that where you source it and actually check the reputation of this company where you source it.
Great. I just put a little thing there to tell the people to, if they've got questions, just to write below. Thanks, Veerle. I think that what you said is actually so important. So I think that most of the pet owners are looking at just trying to sort the pain and inflammation out. And so you're right, they're thinking about those things. But I mean, and when they're thinking about using them, they're also thinking about trying to decrease the use of allopathic medicine like non-steroidal anti-inflammatory. So in using these herbs, they're hoping that they're not going to have to use the non-steroidal, but at times maybe they are. The suggestion of using herbs to decrease the side effects of the non-steroidals and other medications is great, such as liver support, gastric lining support, and things like that. So you mentioned turmeric.
Yeah.
And that's something that a lot of pet owners are using is turmeric paste. Can you chat to us a little bit about that? And you sort of mentioned about the clotting, just about the possible interactions, especially when somebody's using a turmeric paste together with a non-steroidal, like your Rimadyl, meloxicam. Yeah.
So there's some studies that shows that curcumin, which is the active ingredient of turmeric, can protect the stomach. But you can also find studies that shows, reports that it irritates the lining of the stomach. So I'm always very, very careful when I give turmeric combined with non-steroidals. And what I do is I add a herb to sort of, for example, marshmallow root or something to sort of make sure that the tummy will hold, that we don't get vomiting or diarrhea. It's the typical dog that will, 1 spoon of golden paste, this German Shepherd with mild IBD, and, it just literally runs through them. And then, of course, you get staining of the carpet at the other end that you can't remove. So turmeric, I found it can irritate the stomach. It definitely has an effect on blood clotting. You can also, it causes gallbladder contraction. So I had a client and she was taking it herself. And she said, well, I've got some kind of irritation under my rib cage after taking golden paste. And I said, yes, your gallbladder is most probably contracting. Have you got a history of gallbladder stones? Oh, yes, I have. Indeed. It's most probably the turmeric that does that. And then also, if you make golden paste, you're still dissolving it in an oil, so you might actually give the pancreas and the liver a bit of a whack that you might want to be careful with that. And there's also some studies that it actually curcumin can actually have an effect, promote oxalates. So if you have a dog with oxalate bladder stones, you might not want to give curcumin, turmeric. So that's sort of some of the kind of stuff that we use it a lot, and we had a herbal get together with herbal vets in the UK this weekend, and all of us are using turmeric. But I think a lot of us are also very careful about how much pepper we add, because the studies that shows that piperine, the active ingredient of black pepper, helps us with the absorption of curcumin. They were done in rats and mice and humans, and these are not dog studies or horse studies, so we don't really know how much black pepper adding it increases the absorption of curcumin in dogs. So I'm always saying, go careful with your black pepper. I often don't add black pepper, and I still have results. And because turmeric is poorly dissolvable in water, that's why golden paste is made. So it's oil, turmeric, and black pepper. And I always say, well, a lot of people who are giving natural food, meaning cooked or raw food, they're actually quite fatty foods in itself. So if you look at home cooked food, there's quite a lot of fat in it. So then you're adding more fat again to that. So I'm always a bit, why don't you add a curcumin to the home cooked food you're doing, for example, in cancer patients? I said, rather than adding more oil again to the diet. And I had some dogs where we did fecal analysis, and they're on golden paste, and the results of the lab came back, well, there's a lot of fat globules in this stool. So they were actually giving quite a lot of fat. So just to be a bit mindful about those things.
Okay, great. And what about using turmeric paste together with non-steroidal anti-inflammatories? What would you suggest that you gave a smaller dose to start off?
I have my plumber for a minute coming in. I'll be back in a second.
Okay.
A moment, please.
Sorry, guys, a little bit of a interruption there. So if you have any questions, please just post them in the little comment below, and we'll get those. We'll be able to answer later too. So if
Thank you. Bye.
sounds like she's yeah, she's on her way back. If you have questions and you can't stay live with us now, post your questions and Veerle will questions. So you back, get to the questions. He has a chance to even answer typing in the comment section. All right, great. So we were chatting about non-steroidals and turmeric, and whether you would decrease the dose of the turmeric initially, have a lower dose, and then see how the dog responds, and then obviously we want to start decreasing the non-steroidals. So how do you manage that? What is your recommendation?
So the way my practice works, we have a client that comes in and they're on non-steroidals, and they come in and they have acupuncture, some chiropractic, some therapeutic exercise, they do some hydrotherapy, and often actually clients bring up the word turmeric or golden paste up themselves, so I don't even need to prompt them. But like, we read online golden paste, I said, you can give it a try, but you have to tell me, so that if I add any herbs to it, and then what I say is give it the other end of the day. Say you do Metacam in the morning, and I would say do the golden paste not at the same time, do it at another time in the day. And then when I make a prescription, I'll often put some kind of demulcent herbs in. You can use during the day some slippery elm, marshmallow root, or chamomile to make sure you settle the tummy. And then pretty much start at a very low dose and work your way up. I often don't find that I can straight away lower the non-steroidals. That's definitely not the case. It's something that takes time to have effect. And it's very variable, the results. Some dog owners say, wow, it's amazing. And some other dog owners find absolutely no change at all. And when they have no change at all, I always think, we've got the wrong book off the shelf here. We are treating this in the wrong way, meaning we're looking at it not holistic enough. I'm missing a thing. So when you haven't got effect with turmeric or golden paste together with your non-steroidals, then I always say, well, we need to do something else. The body is asking for something else, rather than giving more and more and more golden paste, because it's a great herb, but it's not the solution to everything, and it doesn't suit every dog. So that's the nice thing about herbal medicine, is that you are using herbs. What works for you might not work for me. I find it sometimes too drying as well. Again, some German Shepherds mainly that I find that don't get on with it. And it's sort of, if you do not find any change, just think about it. You're in the wrong part of the library. You need to actually think, sit back, stop it. And sometimes what happens as well, that people, they use it and they say, oh, it doesn't do a thing. They stop it, and then all of a sudden, oh, it was doing a thing. It was making a difference. It was just giving that little bit extra to the patient. So yeah, I would say, just if you're using a bit non-steroidal, go in very, very carefully, and just tell your vet you're doing it, because if you end up with some IBD and stuff like that, they need to know. They need to know.
Yeah, so IBD is inflammatory bowel disease. For the listeners that are listening. So if your dog suddenly starts getting gastric upsets or diarrhea, it might be due to the turmeric paste. Thanks, Veerle. You mentioned about chamomile, and I know in our podcast you talked about using teas. So I'd really like to give the listeners now just some ideas about different teas, and maybe you can talk about chamomile tea if you're using turmeric, just some examples.
The nice thing about chamomile, so we're talking about dogs mainly here. Chamomile is this really nice calming herb for the gastrointestinal tract. So gastrointestinal meaning the stomach, the bowels. So if you have, I pretty much always say, does it pass the granny test, or does it pass the baby test? And when my children were born, they had a bit of reflux and a bit of colicky. And what I would do after every feed, I would drip in some drops of chamomile tea or fennel tea to help them. And in the UK, because where I come, I'm Belgium, and we use herbs much more in daily life than in England. So when I told my breastfeeding consultant, I was sort of like, giving chamomile tea, like, you're poisoning your child, which it's quite normal in Belgium to get breastfeeding teas, and you actually drip it into the mouth of your baby, and it helps with that reflux. So I've seen more and more cases as well where dogs, they're on a polypharmacy, they're on loads of drugs, and they get reflux, and it's that kind of dog that has a bit of a rancid smell in the morning out of their mouth, that gets a bit restless about 2-3 in the morning, does the hunger puking in the morning, goes outside, eats loads of grass and pukes. So what I sometimes say to these clients, in the evening, in with their food, make a strong cup of chamomile tea, fresh, because we're looking at the essential oils of the chamomile, put a lid on it as well, and then add a few teaspoons or tablespoons to the diet, and you might find that in the night you're going to get less of this kind of pacing around, not being entirely right. They don't even need to vomit. I've had a few where then the vet puts them on omeprazole and they do fine, they sleep a lot better, and I say, right, what we're going to do is wean them off the omeprazole and start introducing chamomile tea in the evening. And it's also an anxiolyticum, so it means those dogs that are slightly restless, slightly nervous, slightly anxious, it helps them settle. So I have chamomile every night before I go to bed, because it helps, me settle down and sleep better. So that would be a nice one. The other one is fennel. Fennel, I use a lot of fennel. So sometimes I have a client that actually puts a bag of chamomile tea, fennel tea, and mint tea in a pot, and puts boiling water on it, keeps the lid on it, and puts that in, a tablespoon in with every meal. And the dog would have recurrent bouts of antibiotic responsive diarrhea, especially if it got nervous or was traveling. And now, since they just do that little thing of doing that every day, they haven't had any need for antibiotics or metronidazole for the last 4 or 5 months, and they were having it every time they would have to travel, because the fennel takes sort of settles the cramping, and the chamomile makes the dog slightly calmer for traveling. So it's something that simple, that sorted. It was the cheapest consult this client had ever had, because we didn't even change the diet. We just said, well, let's try this for a month. I think we did some kefir as well, making sure that the gut flora was flourishing, and that's it. We have, I think, dog had one bout, and I said, just increase the dose, use some marshmallow root staff for 10 hours, and was fine. Never had to go on antibiotics. And the owner literally had antibiotics at home because it would get so bad. So, but by doing it every day for a long time, the bowels have completely settled down. So the baseline was much better. Does that sort of answer?
I wish I'd known about the chamomile, because I had 2 reflux babies. And my last one, she was on my chest up until 10 months, and she was one of those, those babies that you had to jiggy.
And you can smell it. You can sort of smell that kind of acid, and you feel sorry for them. But dogs get it as well. How many dogs, when I come in and they're on non-steroidal, I open their mouth, check if their teeth, if what I'm smelling, is it their teeth, or is it actually coming from the stomach? And then you ask them, do they get actually restless in the middle of the night, or do you get that going out in the morning and just grass eating, and sort of, that kind of ferocious eating of grass? And I found those respond so well to tea. And it's not they're not that bad, but sometimes they are put on omeprazole, and you can't, long term, that's not sustainable. And we have these dogs that, diagnosed at 3 years old with bad hips or bad elbows, and they're looking at a lifetime of medication. And you think, well, we need to manage this, because, one of the rehab hydrotherapy patients had a gastric ulcer rupture, and I was like, what? This is never going to happen on my watch, because the dog was on Meticam, meloxicam for, say, 4 years. And I was like, right, that's it. Every dog that's on some kind of non-steroidal, I'm going to just protect the liver, the kidneys, and the stomach. And they just don't even leave the building without a pot of, without the advice of the teas and marshmallow root, sort of a little pot of marshmallow root.
No, I think the reason that I actually got into the field of rehabilitation was because of gastric ulcers. So I treated a dog at like 5 years of age, but he didn't have a ruptured gastric ulcer, but he had gastric ulcers. And I actually just think this is crazy. Here we have this dog that was arthritic, and in trying to help him, a vet prescribed these anti-inflammatories, and he was on drips. He had to have a blood transfusion. And yet this dances dog. So, and I think that one of the biggest problems is we don't know what side effects our dogs are having. If I think about myself, I'm very sensitive to medication. So I've had antibiotics before where I've had like burning of my mucous membranes, very sensitive to light. So there's so many medications that could be having side effects. And I think it's really important, something so simple as giving a tea, chamomile tea or fennel, whatever, just to help them, especially even if you could do it just prophylactically, couldn't you? If you think that.
Yeah. The teas are just available in the supermarket, so if it doesn't pass the granny test, would you give it to your granny in the retirement home at 90? Yes. Would you give it to your baby? Yes. Well, make sure that you think about what you're doing, why you're doing it, make a list of all the medication, think about the possible side effects you might have. And for example, that gastric ulcer dog hadn't vomited once, just went in after 3 years, not being entirely right. I didn't think it even was vomiting. And it was just like, we didn't see it coming. And that was a lesson learned. So even if you don't have a problem, you can anticipate problems, and teas are a nice way of dealing with that, because you don't want to chuck more and more tablets and capsules at it. So again, it's sort of thinking that way, make a list and preempt those kind of these things. And if you have side effects, it's like the immune system is such a kind of especially in older dogs, they're just teetering there, and it's that baseline. You want them to be really good there so that they can deal with these little troughs and peaks.
Yeah.
So yeah.
I think our goal always is first of all, to try and decrease the amount of non-steroidals or drugs we're giving, and obviously minimize any side effects if we're having to give them.
Yeah.
You mentioned mushrooms in the podcast when we did that podcast. I'd love you just to chat to all the followers about mushrooms and how they can use mushrooms with their pets and the benefits.
So when I have a cancer patient coming in, I see a lot of an elderly patient where their immune system, my cat is just God, go. So when they come in, I just never let an elderly or a cancer patient or potential cancer patient, because you got those cases in and you think, you know, the Rottweiler of a certain age, and you think, well, you're in bad books, because we know that from now on, or a boxer, say an 80-year-old boxer, I'm thinking, you're going on mushrooms. I don't care that we haven't found it yet, but you're likely to get mast cell tumors or something. So I will put them on mushrooms as a kind of, because I make custom bespoke tinctures, so I'll most probably put some Ganoderma, so reishi mushrooms. And I've recently started just buying powders and just giving them a little bag of powders. And if they make a fresh food, or even if in some cases they stay on kibble, I said, add this to it. Always start in a small amount. And then, you know, just work your way up. So the beta-glucans is actually the bit that we sort of think about in mushrooms. So you've got chaga, reishi, shiitakes, cordyceps, turkey tail. So there was a study in the States where they found that dogs have a much higher survival rate post-hemangiosarcoma diagnosis when they were on a mushroom complex, and it was mainly turkey tail that was part of that. So I don't get that particular product, but you know, the data is out there, so I say, well, you're going to go on turkey tail. Cordyceps is caterpillar mushroom, shown that it helps with our kidney patients, and it seems to also have some performance enhancing, so we call that ergogenic. It sort of has, in some studies, shows, these are mainly Chinese studies, but that it will improve people's ability to perform in athletes. And if you think about our oldies, well, they are athletes. They are every day dealing with their disability and trying to make the best of it. So why not give them that kind of support without hyping them up? So it's not like caffeine, it's just optimizing their kind of performance. Because if you want to do any physiotherapy exercise or anything, you want them to just be there, be able to cope with that. So that's how I do my mushroom approach. So, and often it's also, I always taste them. So I taste them myself, and they have this earthy, warm, nourishing flavor to them, which makes sense. And now in the UK, you can actually buy the mushrooms in a tray, and it says high in vitamin D. And vitamin D is we know is an important one, and we might have deficiencies in that. So yeah, and I've not had any dogs that didn't tolerate them yet. So I use a tincture or a powder form. You could just do them fresh and chop them up, or in a coffee grinder, the dehydrated freeze-dried one, just blend them down. I think in the States there's a company that makes a mushroom coffee. And apparently, I mean, it wasn't a podcast, of course, he was selling his product, but he was saying this is the most popular coffee replacer on Amazon for the moment. So I think mushrooms are all the hype now. So it's quite easy to source.
So what would the dosage be? So like, say, for like, I mean, you can't overdose on mushrooms.
No, like, think about it as food. Food is your medicine. So, you know, I have in the morning, I'll I'll rehydrate some freeze-dried shiitakes, and I'll have 4 or 5 mushrooms in with some egg, scrambled egg. So, you know, it just start at a small amount and taste it yourself. Think about what you're giving. So everything I give to my clients, I say, you have to taste it yourself. You have to understand what you're giving, and don't give something to your dog that you're not prepared to take yourself. Because sometimes they're surprised that I'm using human grade herbs. Yeah, of course. there's no difference there. Meaning, again, does it pass the granny test? Will I give it to my granny? If not, maybe I shouldn't give it to your dog. Yeah, that's how I. So start with. I wouldn't do extracts. I would do, if you do it yourself and you haven't seen a herbal vet and you don't want to give it in high medicinal dose just as a nutritional supplement, then I would say get freeze-dried, rehydrate them, chop them up. You need to warm them up in some oil, so pan fry them and just put them in a diet. Some dogs will not like it if you put too much in it. It's quite an acquired taste. So a tiny amount, but do it long term for months. That's how you're going to get your sort of effects. And if you want to have a cancer patient, for example, hemangiosarcoma case, or you know, any kind of cancer, you get some professional advice. Just because you want then a higher quality product. That's the thing. If you don't have the response, well, actually, what are you using? What dose are you using as? What is it interacting with? And it's the quality. So the advice I give now, you can go to the health shop and get some stuff. If I'm going to use it for cancer patients, I'm going to use extracts that you can't buy online, meaning practitioner only, where you have to have some qualification in herbal or be a vet or be a doctor to get hold of these things, because then I know that what I'm giving has been analyzed, has good manufacturing practice, blah, blah, blah.
So just to summarize, can you just summarize the benefits of giving, say, fresh mushrooms to your dog?
So it really helps. It helps you. It helps immunomodulating. So it will bring your immune system to where you have to have it. Some studies, for example, cordyceps will help support the kidneys. Turkey tail will help with cancer patients. All the kind of mushrooms help with cancer patients. Reishi is the kind of more calming one of the sort of. Our reishi is actually the one that I'll give to my old ones, where I don't want them to run marathons, so they sort of it's a kind of, I think somebody called it the queen of the mushrooms and Chagas the king of the mushrooms. Sort of, it's sort of a little bit calmer, but mainly cordyceps for your kidney patients, turkey tail for your cancer patients, and then you can just buy generic mixes of different types of mushrooms. But yeah, those would be the 3 ones I use a lot of.
Great. Veerle, thank you so much. We have run out of time, so I don't see any questions there. But guys, if you're listening to this as a recording later, please, if you do have any questions for Veerle, you can post them in the comments. Veerle, you'll be able to come online maybe and just have a look maybe a little bit later on today. Remembering that everybody is in different time zones. So we've got people in Australia that's probably going to sleep now, people that are just waking up in the States. So we've got lots of different time zones. So we often have people having a look later. And yeah, just post your comments and Veerle will answer them. Thanks so much, Veerle. That's been so amazing. I feel like we didn't get to everything that I wanted to chat about, so we might have to do another one. So I might have to do
I'm fully boy.
So thanks so much for your time. I really appreciate it. And and we'll chat soon and hopefully get you online to do another Q&A session.
Bye.
Have a great day. Bye.